How do cancer awareness campaigns identify their audience? Imagine trying to get the right message to the right people at the right time. That's exactly what cancer awareness campaigns do when they identify their audience. They start by looking at who is most at risk for each type of cancer. For example, campaigns about testicular cancer focus on younger men, usually between ages 15 and 35, because this is when the risk is higher. Cervical cancer campaigns target women within the screening age range of 21 to 65 years, especially those who might not be getting regular Pap tests. Reproductive cancer awareness efforts may include both men and women, depending on the specific cancer, like ovarian or prostate cancer. To do this effectively, campaign planners analyze epidemiological data, which means they look at how common the cancer is in different groups. They consider factors like age, gender, ethnicity, and socioeconomic status. For instance, some ethnic groups might have lower screening rates for cervical cancer, so campaigns tailor messages to reach those communities better. They also look at behaviors that increase risk, such as smoking or exposure to human papillomavirus, which is linked to cervical cancer. Another key step is segmenting the audience based on demographic and psychographic variables. This means dividing people into smaller groups based on characteristics like education level, cultural background, or access to health care. This helps make messages more relevant and culturally sensitive. For example, campaigns might use different languages or symbols to connect with diverse communities. Understanding how people behave and what might stop them from taking action is also crucial. Campaigns consider barriers like stigma, lack of awareness, or fear of screening. Knowing these helps create messages that motivate people to get screened or vaccinated. They also analyze which media channels different groups use most. Younger men might be reached through social media, sports events, or online platforms, while women might see messages in clinics, community centers, or health websites. Research plays a big role too. Campaigns often conduct surveys or focus groups to learn what people know, believe, and prefer. This helps them craft messages that truly resonate. Once they understand their audience, they choose the best way to communicate. For example, using the color pink for breast and cervical cancer awareness, or placing ads on platforms popular with the target group. Trusted messengers are also important. Campaigns might involve survivors or community leaders who reflected the audience's background. Their stories can inspire others to take action. Overall, by combining data, understanding behaviors, and choosing the right channels, cancer awareness campaigns make sure their messages reach the people who need them most. This targeted approach helps improve awareness, encourage preventive steps like screening or vaccination, and ultimately reduce cancer cases and deaths. Remember, always consult healthcare professionals for personalized advice, but knowing how campaigns identify their audience helps us understand how vital tailored health messages are in saving lives.